Slowly and gently, allow your eyes to open. What does opportunity mean for you? Do they come by, or do you create them, or both? Since the pandemic hit, the circumstances we faced made it difficult to carry out our daily life as it was, but it also entrusted us with greater responsibilities and possibilities.
The theme for today's panel discussion is yoga and mental health. Has the COVID-19 pandemic presented an opportunity for a promising intersection? We welcome each of our panelists, Professor Danilo Forghieri Santaella, Dr. Meena Ramanathan, Dr. Hemant Bhargav, Dr. Ananda B. Bhavanani, and our moderator, Dr. Meeta Sharma. I request Dr. Meeta Sharma to please receive the certificate of appreciation on behalf of our panelists, and I request Dr. Bhalikar to felicitate our panelists. First on the panel, we have Professor Danilo Forghieri Santaella. Professor Danilo is a senior researcher and yoga teacher at the Institute for Teaching and Research in Yoga and the School of Yoga and Self-Care, University of Sao Paulo, Brazil. He teaches anatomy and physiology in graduate yoga courses and has a line of research aimed at the body-mind interaction with a special focus on the influence of yoga practices on human physiology. His investigations address the following themes and variables: yoga therapy, brain aging, stress, sleep quality, and quality of life.
Next on the panel, we have with us Dr. Meena Ramanathan. Yoga Chabal, Dr. Meena is the Associate Professor and Deputy Director of the Center for Yoga Therapy Education and Research at the Mahatma Gandhi Medical College, Puducherry. She is a certified yoga therapist from the International Association of Yoga Therapists, USA, and is a subject expert for yoga with the Selection Committee of the Government of Puducherry. She is also the external expert with the Academic Council in Chennai. Dr. Meena is the recipient of the Rejoice Ayush Excellence Award in 2019 for Yoga by Rejoice Health Foundation. She has been working tirelessly for the cause of enhancement and empowerment of the lives of the Divyang for more than 15 years through yoga and yogic techniques.
Next on this panel, we are joined by Dr. Hemant Bhargav. Dr. Hemant is an assistant professor in the Department of Integrative Medicine at NIMHANS, Bengaluru. He completed a professional degree in modern medicine and a diploma in community mental health, followed by an MD in yoga and rehabilitation and a PhD in yoga. He was awarded the gold medal for the best MD and PhD thesis. He has more than 10 years of experience in treating patients suffering from major non-communicable disorders through yoga therapy.
And our final panelist is Yogacharya Dr. Anand Balyogi Bhavanani, Director of the Center for Yoga Therapy Education and Research and Professor of Yoga Therapy at Sri Balaji Vidyapeeth University in Puducherry. A Fellow of the Indian Academy of Yoga, he has authored several DVDs, over 25 books and 32 compilations on yoga, as well as published more than 250 papers, compilations, and abstracts on yoga and yoga research in national and international journals.
Session is Dr. Meeta Sharma. Dr. Meeta is a holistic psychologist, clinical hypnotherapist, and a Kriya Yogi Sadhak with an overall experience of 11 years. Her approach is a unique blend of modern-day psychology and traditional Eastern healing techniques. She has studied at the University of Stirling, Scotland and Delhi University. She has worked with Fortis Hospital, the clinic in New Delhi, and with Autism Blue Sky Project. She is a disciple of Yog Martand Yogiraj Siddhanath Sadgurunath, a living master in the Ishwaku lineage. She is a holistic psychologist with the British Psychological Society, Counselor Council of India, and the Indian Board of Alternative Medicine, and also a member of International Hypnotist Guild. She is the first female evening practitioner in India. We welcome you, ma'am, and I request Dr. Bhalika to please facilitate.
Thank you, Dr. Bhalika. Thank you so much. Thank you very much. Namaste.
We now hand over the proceedings to the moderator.
Om. Yogasah chitta vritti nirodha. Can you hear me now? Yogasah chitta vritti nirodha. Yoga is the cessation or the stoppage of the mind modifications. I'm Dr. Meeta Sharma, and this is the second sutra from the Yoga Patanjali. Maharishi Patanjali expounded and threw light upon the very intimate connection between the mind and the practice of yoga. So today we are here and we are going to be talking about this very interesting topic of mental health and yoga and how the COVID-19 has presented an opportunity for a promising intersection. Without further ado, I would like to hand over the podium to our eminent speakers, and I would like to begin with Ananda sir. Sir, the podium is all yours.
योगेन चित्तस्य पदेन वाचां मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रबलं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि। ॐ श्री गुरुभ्यो नमः। हरि ओम। नमस्ते, स्वागतम, वणक्कम, वंदनम, सुप्रभात, salamat pagi, ayubovan, kiyo ora, boreida, depending on which part of the planet from where you are logging in to this marvelous day, a day that we can make great by being the best version of ourselves. I congratulate Kaivalya Dhamma on this 10th International Conference and the topic of yoga and mental health. This is the most important aspect that we need to bring into our consciousness at the very present moment. When we talk about mental health, we have to talk about yoga. Because as Dr. Meeta brought out, Maharishi Patanjali has given us the Yoga Darshana. The Yoga Darshana, that is a reverential perspective of the universal reality through the lens of the principles and practices of yoga itself. And Maharishi Patanjali was way beyond his time. In fact, I feel Maharishi Patanjali is a future being. He is a time traveler from the future who in his infinite grace has gone back to the past, given us these teachings that are as relevant, if not more relevant today than ever in human history. When we look at the concept of mental health, we need to move from the concept of arogya, which is the absence of disease, arogya, to one of swasthya or swasth, which is wellness, wholesomeness of the complete human being. This type of change in paradigm from one of a pathogenic orientation, looking at disease, to one which is looking at health and wellness and well-being, salitogenesis. We need to make this paradigm shift from pathogenesis to salitogenesis. Arogya to swasth. And when Maharishi Shushruth tells us about swasth, he says, it is samadhosha sama agnischa samadhatu malakriya prasanna atma indriya mana swasth ityabhidiyate. There has to be harmonious balance at all levels of our constitution. And there has to be tranquility of the mind, the senses, and the sense of self itself. This is where yoga comes in. Because yoga is not just something you do. Yoga is something you live. Yoga enables us to be in that state of being that has been lost as a human being. We have moved from being a human being to a human doing. We need to retrace our path, moving from human doingness to human beingness. This is where yoga and mental health come together. So one of the spin-offs of yoga, because we tend to get locked into the concept of yoga for something. The moment you say yoga for something, you have put the cart before the horse. We need to look at the concept of yoga for the sake of yoga itself. When we live yoga for the sake of yoga itself, the rest of the benefits will happen automatically. You be human for the sake of being human, you will automatically be physically healthy, you will be emotionally balanced, and you will be mentally healthy, and you will have a sense of spiritual oneness. This is what is said in our culture. Dharma, artha, kama, mokshanam, chaturvida purushartham. By following dharma, you come into that space where artha, kama, moksha will happen. Today, more than ever, the world has shrunk. And just as the movie goes, Honey, I Shrunk the Kids, well, COVID has shrunk the world. Instead of having to travel for 48 hours, 72 hours to be in one place at one time for one purpose, we can all, as is brought out in today's panel, be in different parts of the country or different parts of the world, and yet all be in the same place for the same purpose at the same time. What a gift of technology. We have had it, but we didn't know we had this gift till the COVID pandemic came in. The moment the COVID pandemic came in, we were forced to move online. All of us had no choice. And we started to realize, despite the physical distancing through the Akasha, the internet, it is the Akasha Devata, the gods of the internet, who we have to always say, Om Akasha Devaya Namaha, because they should be kind to us so that we don't lose connectivity. We realized through the internet connectivity, all of us actually came closer over the last 18 months to 2 years. Today, we find that the inherent compatibility of yoga with mental health, the intrinsic correlations between yoga and mental health, we are able to understand better, we can share better, and we can utilize better thanks to the COVID pandemic. And in all this suffering, and I offer my prayers for the Atma Shanti of all those who have suffered during this pandemic. But yet in this intense dukkha, we have also found the light. And the light is that we can all come closer together. We can share with each other, because to be human is to share and care in a loving, compassionate, empathic manner. We have seen in this period that the COVID pandemic has given us this opportunity to bring together that which already was there. Yoga's chitta vritti nirodha was already there so many thousand years ago. It has always been there, but today we have understood the importance. We have understood the importance of Pratipaksha Bhavanam, the traditional teaching, which today has given rise to CBT. We have understood the importance of pranayama, that today has given rise to cardiac coherence breathing. We have understood the importance of dharana, dhyana, and samadhi, that today has given rise to the mindfulness movement. So many of these traditional teachings, thousands of years, we forgot about them. And today we are reinventing the wheel. These teachings are already there. Maitri Karuna Mudito Pekshanam Sukadukka Punya Punya Vishayanam Bhavanataha Chitta Prasadanam, says Maharishi Patanjali. How you choose your attitude determines your response to whatever happens to you. And that choice is the superpower of being human. The power of choice is the superpower of being human. And today we have an opportunity to choose our attitude. With these opening remarks, I would like to give over back to our moderator and my fellow panelists, because we just have amazing stuff to share with all of you. And what a great opportunity we have today. Let's make it a great day. Namaste.
Namaste. Okay, so I thought like the audio was not working.
We can hear you, Dr. B.
Manushya, Manav, human being. Somebody who has a manas, and that is what we are talking about, discussing about mental health, how important it is for a human being to be able to, have that important health component. And this is very, very important. And because we are working at a hospital, if my PPT can be presented. At the outset, let me thank the organizers and congratulate them for this topic, which is much in need nowadays. And congratulate them and gratitude for this wonderful opportunity to be able to discuss this topic here. We are working at a hospital-based center. Vidyapit. The next slide, please. Where we are focusing on this since 2010. And for the past 10 years, especially now, the past 2 years, we have been focusing more on these things now, where the focus is on salutogenesis, where the focus is on health and wellness and not on the disease causing factors. And, like morning, the whole of SBV, all of us at SBV, the Sri Balaji Vidyapit University, the student population, the staff, the faculty, everybody has a chance for yoga therapy, because this is part of their curricular activity, part of their elective activity. And we have a rural health center where we are reaching out to the population, the local communities. And the other outreach activity is focusing on the caregivers, the supporters of the Divyanga, the people, children with special needs, the senior citizen who are, like this is something which they cannot access nowadays. And so we go to their doorstep and try to give them the awareness of these practices, how important it is, especially during the pandemic times now. And the transgender population who are at the brim of the society, fringe of the society, where they do not have this access. So we try to go to their doorstep. The next one, please. Yoga Bhyasa, through this program, next one. Through this program, we have the access, like all the students here, the medical, the dental, the nursing students, allied health students, the pharmacy students, the physiotherapy, all of them. Next one, next slide. All of them have access to yoga. And, we are trying to take it to them so that once they realize the importance of yoga, these are going to be the future healthcare providers. So how is it that this technique is going to be taken, yoga as important, the significance of what yoga is all about in everybody, humanity needs it. So how are they going to take it forward into the society in future? And we had, a survey taken as about the stress levels that have been found in these pandemic times among the healthcare providers and among everybody, where, with the psychiatry department, we had this and started giving yoga sessions for them based on, the government, the social policies, social distancing and all those hygiene norms. And what we found was there was a 48% reduction in anxiety levels among the participants, even in a single session of yoga that was given to them. Next slide, please. If you can see, that's representative samples of our nurses, the faculty, the staff members. Next slide, please. Even the cleaning members, the cleaning staff, down to that level, we are taking yoga into, so that, everybody is happy and well, so that it can be the whole atmosphere here at the hospital is being, again, radiating that wellness, so that the patient who comes in here has that sense of wellness also when they go out. The next slide, please. Yeah, taken into the wards where directly you see, the psychiatry patients, neurosurgery patients, all of them have access to yoga. Next one, please. When we are talking about this intersection, the complementary therapy now coming in with the modern medicine. So yoga therapy is an adjunct therapy as a complementary to the medical treatment that is being given, which, each and every patient who come in here has the access to. And as you see, during these 2 years, patients getting admitted into this hospital, Mahatma Gandhi Medical College, which is part of our university, where we are working, a center for yoga therapy right in the middle of the hospital. And all the patients who were admitted in the wards had a chance, opportunity to be able to, so 4 days, next slide please, 4 days a week, we used to go there into their wards. So if you can see the pictures of, our yoga instructors in a PPE kit, going and giving yoga therapy, simple techniques where they were made to have an awareness how breathing is important, how they can let go of all the tensions and positive feedback from all of them. And those who come back now, we realize that the long COVID symptoms are absent in those patients who were undergoing this yoga therapy when they were admitted here. The next slide, please. Next slide, please. Yeah, and home care. So we were able to, through the healthcare services, we were able to reach into the homes of people who were quarantined, and we had the online sessions. We would consult them online, and online sessions where if you can see pictures of those people who are practicing, as well as our instructors giving the sessions to them. Next one, please. Just a few representative samples, and we had the International Day of Yoga celebrated in this topic during the COVID times. Next one, role of yoga, importance of yoga, and why do we need? And we had a self-care, yogic for self-care during the COVID-19 pandemic, where morning and evening, it was a Facebook live page which was created by Saita, and we had morning and evening live sessions. All our students were part of it, and we used to take it to them, and those who got back to us, we gave the videos to them for different populations, senior citizen, the children who are at home undergoing the online classes. So it was taken down to everybody. I'm just mentioning a few. Next one, please. And thanks to Ananda sir, because the 108 days of continuous Vishwa Yoga Prarthana which was done, like for the Sadgati of all those souls who were suffering and who had departed because of this dreadful disease. And we again got wonderful feedback that like enhancing the mental strength, that others are there with us. So that is something which is very important. Though they are inside their homes, locked up inside their homes, and they are not able to move out, but still they had this consolence that there are others who are supporting us, there are others who are praying for us, giving them a lot of strength and courage to pass through these. The next slide, please. And a few cases I'm just going through very quickly. The long COVID case which came, and we gave them yoga therapy, a few techniques, very, very simple techniques, because they were having difficulty in breathing, chest tightness, and all those who were quarantined and very, very mild symptoms of COVID and home quarantine. But now they come and tell us that it is very difficult nowadays to the fatigue, high amount of fatigue. They are not able to do anything, normal chores, which is very difficult for them. And with yoga therapy, their oxygen levels seem to be improving, and the pulse rate seem to be coming down, because they had tachycardia, which was like raising pulse. So that was something which was affecting them. And next slide, please. And this is something which is very close to our heart. A person who is very, very closely associated with us at Saiter, somebody in our university, and very close associate of Dr. Ananda. And though the person and his mother got admitted into, have been patients of COPD for a long time, and both of them were COVID positive and got admitted with low oxygen levels and very, very critical condition. Both of them admitted into ICU, sorry. And what happened was that the mother passed away after a few days of treatment. She didn't sustain, but the other person, the son, lived with lot of problems, atrial fibrillation and all that. So online consultation was given to him, and now he is a practitioner, but the long COVID again is not affecting him. Though a COPD patient, and now he is able to sustain with a few practices. Though he has symptoms of vertigo, he is under treatment now. And the only best thing is that, though he was encouraging his wife and son, both of them being champions in yoga, but he has never done any practice because he was not really into this, though a supporter. But now, first-hand experience of being admitted with COVID, And seeing at close quarters how he was so desperate to try to reach out to his mother, but he was not able to do it. But now he is a regular practitioner, and he is spreading word across to each and everybody that how beneficial, first-hand experience, how beneficial yoga therapy has been to him. And now everybody, next slide please. The healthcare workers, the burnout symptoms, stress symptoms alleviated for healthcare providers. Next slide, please. I'm just rushing through. Next one. Next one. Yeah, and we found this is something like a pilot study we undertook. Effect of just one technique, immediate effect of pranava pranayama on oxygen saturation and the pulse rate levels, heart rate levels in normal volunteers. Next slide, please. And we found tremendous improvement in the oxygen levels with pranava pranayama, though the pulse rate was coming down in both, the quiet sitting and pranava, but significant improvement of their oxygen levels was found in normal patients. So definitely it can be applied in patients suffering from this, and definitely we would like to collaborate with others who are doing such studies so that we can establish all this with a multicentric study also. The next one please. Next one. Next. So different populations having next, keep pushing. Different populations having a feel of yoga, where we it was taken down to the grassroots level, and outreach activities, if you can see, especially the caregivers who are under tremendous stress, because the care the students who go to school, especially children with special needs, if they are at school they get a little relief, but now they are not going to school, so it is like totally on the parents, and we are trying to give a lot of therapy into them for alleviating the stress. And next one please. The transgender population, next one, into the community, where you can see they are all having sessions. Next one. Yeah, so best practices also, where what was taken down have been established as copyrights. Next one. And Adi Vyadi, as we can see, go on. So the stressor that is affecting their mind, and how, next one, how through yoga practices we can alleviate that, we approach the mind directly, so that the stressor doesn't, we change the way the stress is modified, the stress is modified, so the perception is changed. And through these yoga techniques, the practices, through this yoga therapy, which is an art, science and philosophy, we are able to alleviate the whole outlook, the whole bhavana, as Ananda sir was saying, and get that sense of health and wellness. The next one. So that's it. So I think I have just briefed up on the activities of cited. Next one, please. Yes, next one. Thank you for this wonderful opportunity. We'll meet again. Thank you. I give over to Dr. Meeta now.
Thank you, Dr. Meena. That was very enlightening, and it has opened up a new space for all of us to understand the work that CITER is taking at so many different levels. I now invite Professor Danilo for his opening comments. Sir.
I'd like to thank Subhoji for his kind invitation for me to take part of this much and very important event, scientific event on yoga research and tradition conducted by Kavalyadem for the 10th time. It's an honor to be here, even though through the internet, as Ananda Balayogi just pointed out so fantastically. I definitely agree with him that the pandemic has made us use this technology that we had already available for us, but we didn't quite make the best use of it. So we now can make the world a little bit smaller and be closer to each other, even maybe getting closer to the cities that Sri Patanjali Ji has pointed out, being in different places at once. It's very enlightening to listen for the opening speech when you pointed out the second sutra of Patanjali, Sri Patanjali Ji, saying, reminding us of the Chitta Vritti Nirodha meaning. And as I listened to it and read the name of the lecture, I just couldn't help but remembering that when I go to some congresses all around the world on yoga and meditation, I tend to think, and sometimes I also make my comments saying, okay, but why are you talking about yoga and meditation? Yoga is meditation. And when I see yoga and mental health after listening and remembering the understanding and translation of Chitta Vritti Nirodha, I just can't help but think, even though in a slightly reductionist way, that yoga is mental health. So, in my opening speech, I just wanted to remember that we have a great mission for this post-pandemic period that is yet to come, because the pandemic hasn't finished. We have a psychological pandemic that is already happening. All the world is suffering from psychological diseases, which has gotten much worsened with enclosuring, with the lockouts, lockdowns, and isolation, and fears, and post-traumatic stress disorder, and depression, anxiety, and so on, and so on, and so on. So yoga as mental health and mental health provider has just a great benefit to offer to all the world again. Thank you so much. I hope I can share something about it with you.
Professor Danilo. And I now invite Dr. Hemant for his opening comments.
Thankful to Subodh Tiwari ji, Kaivalya Dhama, for giving me this wonderful opportunity to be with this august audience and with the esteemed speakers. Professor Ananda Balayogi is my guru. He did his MBBS from the same college that I did. So we are following his path. I also thank all the audience who is patiently sitting there and paying attention on us. The theme for this discussion we have is the intersection, between the COVID-19 pandemic and the mental health, and the role that can be played by yoga. Professor Danilo, Meena Madam, and Anand Balayogi sir have already covered the most important points. One more aspect that we at NIMHANS, felt is the mental health of the young ones, children, adolescents, college-going students. Suddenly their life changed, unprecedented in an unprecedented manner. It is 2 years now that children have not gone to schools. They have not met their teachers. They have not played in the playground that they used to play. They are spending most of their time on mobiles. They are playing games. They are watching TV. Their sleeping patterns, their biorhythms are going haywire. And suddenly there is a surge, at NIMHANS in the child and adolescent psychiatry department. Children who are in 4th standard, 5th standard come and say that I don't want to live, I want to die. Suicidal ideations in small children. You cannot just believe it. They feel nobody loves me. There are anger outbursts. They have become so irritable. So their sleeps are disturbed, their appetite are disturbed. And in this pandemic, technology has grown, and with that also has grown our habit of ordering food items from outside, Zomato, all those, Swiggy. A recent study showed that women who are from well-to-do families were more nutritionally deficient than poor women, only because the frequency that they were ordering food from outside and eating was significantly higher than poor women. So poor women will cook her dal, rice, chapati, and will cook it at home using minimal oil. But when you order it from outside, no matter how organic it is, no matter how good the restaurant is, be sure that you are depriving your health. And the same food the mother eats, gives to the whole family, gives to the children. And food in Ayurveda or yoga, your GI tract is very intimately connected to your brain, to your thoughts. So it is here that from the sleep waking pattern, disturbed biorhythms, exposure to screen, and then the dietary habits, everything has changed. And then here that there is a need for a complete revival of the lifestyle based on the traditional principles. My special concern is for the new generation, for the children, and for the students of India, which will make the future of India. So we at NIMHANS started yoga for children, and these sessions have been going on for last 6 months. Especially 2 modules were developed, children from 5 to 10 years of age and 10 to 15 years of age, and we used a lot of animations to engage them. And we were happy that children actually liked it because they could.
Thank you, Dr. Hemant, for sharing your experience with us all about the work that is being undertaken at NIMHANS, and of course the importance of food, which is a very important part of being a yogi. I would now like to open the floor for questions from Dr. Ananda. Ananda sir, I have a few questions for you, and of course your presentation. And you are an inspiration for all of us, especially the mental health care professionals and yogis. And I want to know your thoughts on introducing yoga as a first or a second line intervention today in the field of mental health. Sir, can I know your thoughts on this?
Thank you so much, Dr. Meeta, for that question. I, as a medical doctor, believe that we have it all wrong. That what we are doing is we are going in the reverse order. So first the person goes to the super specialty hospital these days. And once you get into a super specialty, you cannot get out. This is actually what happens. So people are choosing to go to super specialty hospitals straight away. And then after going through the whole spiral of all the treatment-related costs, side effects, emotional difficulties, family haywire and all that, Finally, at the end of everything, they come to yoga. So what has happened is we have it in the reverse order. We should try to get people to come to yoga first. If yoga cannot help them, then we add on the other therapies. So rather than the modern approach, which is yoga is the add-on, I think we should start with yoga and then the other therapy should be add-on. And my own mentor, Professor Seduraman sir, who was our previous vice chancellor and my professor of medicine, he used to tell us of medically unexplained symptoms, MUS, and you can Google it. And up to 60% of people coming to the hospital have symptoms that cannot be explained by any diagnosis. And so you keep on going from one department to the other department, to the other department, to the other department. When you can find nothing, they say, oh, it must be in your mind. So go to psychiatry. So psychiatry is the trash bin of the hospital. And in our hospital, the trash bin of psychiatry is yoga. So when psychiatry doesn't know what to do with their patient, they send them to Psyter. Now, the medically unexplained symptom, if you can get that 60% of the care seekers into yoga first, you may actually solve the problem without having to go to any medicinal, pharmaceutical intervention. So I believe that the first line in all medical institutions should start to become yoga, natural therapies. If you cannot help them, then they start to go to general medicine, they start to go to surgery. So somebody has hernia, let them go to surgery, I have no issues. Somebody has cancer, let them get the cancer treatment with yoga as an adjuvant. But somebody is coming in with a headache. Somebody is coming in with something that is definitely psychosomatic, stress-based. Why should we start them on medicines? Most of the time, they will never come off the medicine. So to answer your question, yoga should be first line of treatment. It should be the foundation of treatment. And then other forms of therapy should be add on to it. But the caution, as a yoga therapist, we should know our limitations. Yoga is not the end all be all for every condition. Yoga can help every human being be a better human being. They can help them out of suffering. But let us not think that if somebody comes in with third stage of cancer, that we are just going to treat them with yoga. Somebody comes in with acute epilepsy, seizure. Don't say, oh, I'm going to teach you some Nadi Shodhana Pranayama. Somebody comes in with status asthmaticus. Well, you have to give them immediate nebulization. So we need to understand the place of yoga as a therapy. We have to understand the strength and the limitations. And if we do that, I think we will have a healthier society, and healthcare, which today is disease care, will start to once again become healthcare.
Ananda sir, you've created Chitta Prasadanam for us all, clarity of mind, where yoga fits in with the medical science. So my next question to you will be, and you've already spoken about this, so I would like you to expound on it. Our traditional yogic practices and how these have been, modernized today, I should say, and how they are already being used, and how we can go back to these traditional yogic practices and understand their place and importance in medical science today.
What I would say is they have not been modernized, they have been misappropriated. We have the traditional teachings. As Danilo pointed out, yoga is mental health. It's not yoga for mental health. I'm okay with that but if they had said yoga for mental health, I would have also said there's something wrong. Yoga and I'm okay with it, but yoga is mental health. We need to understand our culture. Because we have not valued our culture, we are sitting on a treasure. The De Beers diamond mines in South Africa. The person who first had that land was a farmer who couldn't grow anything. And he thought, I have a worthless piece of land, and he sold it. And today the largest diamond mine is on that same land. I often think we Indians are like that. We are sitting on this diamond mind, platinum, plutonium, whatever those most priceless metals are. We are sitting on it, but because we don't know it, we think, we'll wait for Americans to teach us yoga. We'll wait for it to come back from somebody with their evidence-based. I think we have to understand our culture has amazing teachings. We need to have a modern interpretation of the traditional teachings. We have to relook our interpretation. We have to relook our translations, because many people who translated the yoga scriptures were scholars, they were not practitioners. We need yogis to retranslate the scriptures in modern language. Because what is CBT? It is nothing but Pratipaksha Bhavana. What is cardiac coherence breathing? It is pranayama. What is all this mindfulness-based movement? It is all nothing but dharana, dhyana, samadhi of the Indic traditions, Hinduism, Jainism, Buddhism, that have the India has been taken out of it, and then you call it something else. As far as I'm concerned, and these are strong words, but I am standing up for it, this is intellectual property theft that has occurred against the Indian classical teachings. And recently I put out a book on this, The Cultural Misappropriation of Yoga. It is for free download. But what we need to understand, we cannot blame the West. We must first take the blame ourselves. Because we do not value our systems, others have taken it, found value, and now repackaged it, and we are paying dollars to buy back what was initially free for us. Same like the drinking water, which should be free for every living being. And it is packaged in plastic bottles and sold by multinational companies. Same thing has happened to the Indian cultural treasure. We need to reclaim it. But first, we need to respect it. We need to practice it. We need to value it. And then when we stand up and practice it, value it, and retranslate it, I think then the whole world will understand what a valuable treasure we have.
Thank you, Ananda sir, for sparking this fire and encouraging us to go back to our roots. So I hope... Right. So my last question for you is one word: psychoneuroimmunology.
That is
Your
nothing
comments.
but Adija Vyadi, Anadija Vyadi of Yoga Vashishta more than 5,000 years ago. More than 5,000 years ago, the Yoga Vashishta tells us that your mind and your connectivity or disconnectivity to the universe will impact your health. If you feel oneness with the universe in which you live, you will be healthy. If you feel duality, dichotomy, you will be unhealthy. So where do you have to go? The root. The root is the Adi. How are you connected to the universe? And this is the core of a sense of coherence, which is today called celitogenesis, where you feel my world is understandable. My world is not only understandable, but manageable. And not only is it understandable and manageable, but it has purpose. That is the core. And yoga is the best way to start to be at ease with ourselves. Go inside and find the Sukha Sthanam. Regain your health, your happiness, and that higher state, which is moksha, mukti, nirvana, and kaivalya.
Thank you, sir. I would now like to move on to Dr. Meena. Dr. Meena, my first question to you will be your experience in these pandemic times working with patients with long COVID and post-COVID recovery.
Yes. So as I was looking at the, like presenting about the case studies, the case reports. So this is what, the long COVID symptoms as it was explained. What is happening is that they have breathlessness, tightness, and most often, like it's difficulty in their doing their everyday chores. Whereas with yoga techniques, which is being given during the pandemic times, I mean, when they were COVID positive and when they were admitted, if yoga is given to them, we found that, the long COVID symptoms are absent in those patients. So that is something which is a positive finding, I would say. Those who were home quarantined without yoga and those who were hospitalized with or without yoga, there's a difference. So with yoga, we found that the long COVID symptoms were definitely absent. And those who were associated with yoga, but not actually a practitioner of yoga, we found that nowadays they have taken to yoga practices and they are becoming regular practitioners and they are propagating these techniques also. Like sir was saying, we are in the middle of that acres of diamond field, but have we realized the importance, how it is, how much we need it and how much we need to take it to others, how important it is? But I don't know whether we have realized it now. Maybe as first-hand practitioners, one is we realize and we take it to others. And the second thing is, when we look at all these pandemic, like everything is going around us, we hear about all this as a news in the channels and, like in the hospitals, we hear about all this. But first-hand experience of all this is something which is going to shake you from within. The trauma which you're going through, the anguish, whether your relative is okay, the frantic way in which the people at home, they are trying to reach out to these patients, it's really pathetic. And these are, the caregivers who need all this, the care, which is definitely the word which is needs to be underlined, and how through yoga therapy can we take this forward to these people who are, suffering from that state of, like sir was saying, dukkha, the anguish, the distress. How can we, simple techniques, letting go of all that they are holding on, how you can alleviate that state so that they can come into that state of sukha, the pleasantness, and stay without that dis-ease and stay in peace with themselves, at ease. So
Thank you, Dr. Meena. My next question is in line with what you just said. We often ignore the caregivers of the people who have suffered from COVID and all other mental health issues. I would like to know how you, as a yoga practitioner, as a yoga acharya, have been supporting them and how yoga can be used in this space.
Sighter, what we normally do is that, the patient who's accompanied with the caregiver, we tell them to please come in and do the session with them. Because when they are just going to be onlookers, staying outside, sitting, waiting for them, and now they come in, like how we bait them to come into the session is when the patient is doing, if you can observe it, and give them the corrections when they are doing it home, it will be easier. And then you bait them, pull them inside, because they don't want to. I don't know why they are holding tight, and refusing something, that which is useful to them. But once they get a first-hand experience, so when they come inside and start doing the practices, it is more often more than the patient themselves. The caretakers are under more stress. Because the cares, the patients are in bed, they are getting all the attention, they are getting treated, but the caregivers are going around, lot of stress because they have to be traveling up and down, and they are anxious, like what is happening to this person who's so close to them, be it a husband, be it a son, whatever the relationship is, and how do I make them okay? And like apart from all this stress, they are going through this, which is like not looked up at all, which is not considered as something which is important. Because this stretch that is happening now, what is going to happen? The burnout is happening. This is like the exposure all the healthcare providers are going through now is like a burnout to them because of the uncertainty, the fear, what is going to happen to all of them. They are not sure whether they are doing the right thing, but they keep, it is like blindfolded and you keep hitting the bush. Are we in the right track? Yes. So there are a few authenticated, yes, now established, research studies which do point out and say, yes, this is going to alleviate the stress. And first-hand experience is that the patients, the caregivers who come in and experience this along with the patient, it is like more relief for them once they start doing it along with them. So it's just that they resist it in the beginning, but once you pull them in and once they have this feel of what it is all about, then it is like mouth to mouth publicity. They go and publicize, saying that yes, please do it. So when we go into the psychiatric wards, for example, at this hospital, we go into the psychiatric wards and give yoga therapy for the patients. And we also, compel the caregivers who are standing around outside the wards, please come in and do it with them. And, when they are letting go of the tensions of the patients, it is more the caregivers who are benefited.
Thank you, Dr. Meena. I have one last question for you. A lot of us know that you spent 15 years working with children with special needs in your project Divyangana. Could you tell us how yoga has played an important role in the times of the pandemic for these children?
Like the normal population, yes, we have other outlets. Like how do we let out the stress? How do we go out? There are other things that we look out to. How do we channelize our mind? But for Divyanga, there is this suffocation that is there within, which they do not know how to let go. Like Hemant Bhargav ji so beautifully put out, the children, because of their immaturity, they do not know how to get it out, how to, express that frustration, how to express it out, how to let it go. So it is like the parents who are the first hand people whom it is taken out on, the tantrums, like that they do, the attention seeking devices, the children often do that because they are not able to let it out, what they are going through inside. And when they go out to school now, because of the pandemic, all schools are closed. Especially the schools with catering to the needs of children with special needs. So what happens is that they are all at home inside the four walls. So what is it that could be done? So we are trying to, with these children, it is always better that you go directly, and supervised sessions are better. But like instead of having nothing, what we are trying to do is like let the parent be along with them, guide them. We are trying to make it online for these children now. Danilo sir and Anand sir was saying, the world is so small. So you don't have to come out for, availing all these facilities. You can stay inside the comfort of your home and, get exposed to all this. Only thing is, please go through them, and, it is for your own good. Experience this and come out of that, anguish where you all are very willingly staying. That is something we keep telling them. Please don't stay there. It is not permanent. Like everything is moving out. The certain, like the uncertainties, we have to move out of them. There's no other way. We have to perceive all this in a different way. Like we keep telling, difficulties, the struggles are something that is to make us stronger. So just to enhance our strength, these are testing times that we are going through. So the strength is being tested, yes, but what comes out is going to shine. Like the ornament that is made from gold, it has to be the particular shape, everything has to be exact like what we need. So what the human being is going to be beyond all the religious beliefs, beyond all these the boundaries that we have created for our own selves, we are moving ahead. Definitely, yes, there's a positive thing that is happening. Even at Saiter, that is what we are going through, like all the other, there's nothing that is creating this boundary. You are somebody else. No, all of us are one, and we have to hold our hands together during these tough times. And we do get invites, it is unbelievable, from hospices which are being run by the Christian organizations. Please come to us and please give us these practices. And we do go out as part of our outreach activity, go out to them. It is for humanity. It is for the betterment, for the improvement, for the sake of humanity, for them to have that, attain that state of swastha, health and wellness. So all of us need it. So let us all hold hands together and let us take it forward. So we have that duty, the responsibility, that dharma, to take it forward in that positive way. Unless and until we have that conviction, how do you take it out? Be it Divyanga, be it anybody, everybody needs this. So this is the need of the hour. So let's do that with conviction.
Thank you, Dr. Meena. I'm sure we will all step up and answer this call, this need, address this need. I now invite Professor Danilo. And sir, if you could talk about your work as a researcher and a yoga therapist.
Thank you so much. I will just share some slides here. Where are they? Let me see here. Oh, yeah, here. First of all, I'd like to show you the evolution of COVID in two countries of South America from the middle of the year to up to now. Here we can see Argentina, and in December you can see a sharp increase in numbers and cases. And here Brazil, you can see a trend towards a great decrease. However, even though this might sound like very good news, we know that this is not specifically true, because here we are around the house of 10,000 new cases, and here we are around the 2,500 new cases. And of these 9,000 new cases, all the most severe ones are due to people which have refused to get vaccinated. We have some very nice people doing some interesting works, social works, trying to spread the word of trying to integrate actions on prevention and treatment on COVID for vulnerable populations in Brazil, as indigenous and people who really, these are also indigenous population. People think that the indigenous population in Brazil live like this, but they actually live in situations like that. And favelas people used to live with sanitation situations like these ones that we all know are realities which most countries face. People like to think that the elderly live like this, but we have a great deal of the population, of the elderly population, living in such a situation like this one. We also still have quilombola communities here in Brazil, people who are descendants, they are granddaughters and sons of slaves, freed slaves that went to places inside the forests to try and make their livings, and they have no electricity, no sanitation, and whatsoever research on health providers. This kind of situation in Brazil is different from countries in the Western or Northern Hemisphere, but also we have some similarities. For instance, in the Lancet medical journal, we have research that has shown an increase in cases of depression and major depressive disorder and anxiety and major depressive disorder due to COVID. And amongst those, major depressive disorder had a greater prevalence amongst women, which also happened with anxiety. So women are more prone to develop mental illness than men during the pandemic, and also are younger people than older people, both to depressive disorder and anxiety disorder. In Brazil, we also have that tendency. And if we take this very, very new paper published in the Journal of Psychiatry Research in this year, we can see that anxiety was the major psychological disease, followed very closely by depression and anger and somatic symptoms, okay, and sleep problems. Here we also have shown post-traumatic stress disorder that is also shown as a very powerful problem faced by people after COVID. But one very important thing to point out is that the predominance is on moderate to severe depression, anxiety, depression and anxiety. So it's not mild to moderate. It's normal to mild. It's moderate to severe. So it's a huge problem. And we have shown that practicing Bhastrika Pranayam, one month of Bhastrika Pranayam, 25 rounds of Kapalabhati done the proper way, as instructed by the Hatha Pradipika and the Garanda Samhita, followed by one Surya Vedana with the Tribada 10 times a day, twice a week, can increase brain connectivity. And we know that increased brain connectivity may be one of the indicators of decreased anxiety. And in this paper, we have also shown a decreased anxiety, mood, increase in positive mood and decrease in negative mood, showing that yoga may in fact have impact on positive mental health. So thinking about taking those kinds of effects to people that have had COVID, and have been suffering from those post-COVID effects, we've initiated this Living Lungs project, a free online yoga program for post-COVID-19, with special emphasis on breath awareness based upon Dr. Boliji's teachings on Yoga Anubhava. This was the second program. The first one lasted for the 3 previous months. The first one helped around 450 people, and the second one around 380 people. And here I will read for you just two declarations, two spontaneous declarations of them. My breathing is always much easier. After classes, shortness of breath decreases and I feel more energetic. As I had to be intubated for 15 days and I was hospitalized for 42 days, my muscles were weakened. I couldn't even walk. With the classes, my muscle tone was reestablished and also my breathing improved a lot. I just have to thank you for that. Rich experience. I'm already acquiring awareness and expansion of respiratory movements. It is helping me relax and also to be more present in everyday life. Much obliged. So, with that, I thank you for your time and I return to you. Thank you so much.
Thank you, Professor Danilo. You've just elaborated for us how things are on the other side of the world in South America, and you've thrown light upon that. And I know it's about 2 a.m. for you, so thank you for joining us today. I have just one question for you. Your experience as a yoga therapist, your experience as a yogi whose main work has been on breath work, your research has been on that. Is there a magic formula that you follow? I know you've already told us a little bit, but just to kind of expound on it, just to elaborate a little bit for our audience, a magic formula that you would leave for the common man.
Yes, there is a magic formula. Pay close attention to it. Practice yoga.
So then I have to ask you one more. You said yoga is meditation and mental health is yoga. Any other further thoughts on that?
Yes. You see, when sometimes people like to use the image of an iceberg to talk about asana and yoga. And they show the tip of the iceberg and say asana is just the tip of the iceberg of yoga. Meaning that there is so much more in yoga than asana. If I were to believe that, I would believe that asana is no more than the physical aspect of yoga. And then I would believe in the statement yoga and meditation. But if I truly try to understand the 5 main principles of asana given us by Sri Patanjali Ji, Stira Sukham Asanam Prayachna Shaichilyananta Samapachibhyam. I have to understand that asana is meditation, especially through Ananta Samapachibhyam. mind in the absolute. I have to put my mind. What is this Ananda? Samapachibhya. My mind in a so huge of a serpent that the universe is on top of its head. So I just dissolve my individuality in the universe. What is that if not meditation? So, if I come to take the image of the iceberg, I would say the physical aspect of asana is just the tip of the iceberg of asana. And then one would come to understand a little bit more of yoga and wouldn't make these misunderstandings that come, that make Indian government, Ayush, to want to put yoga in the Olympics. Who am I to tell you that? Who am I? I'm an outsider. I'm a Brazilian. And I'm outraged with the invitation I got to be its representative here in South America. I had to say no. I had to call Subodhi and say, Subodhi, what's happening? Does Kaivalyatam support that? I can't be that man. I can't represent it here. Otherwise, I will just deny everything I learned from you there in Kaivalyatam. That's why what I believe. That's why I say yoga is meditation. That's why I say yoga is mental health. That's it.
Professor Danilo, for me, the key statement for today was yoga is mental health. Thank you so much. We now have Dr. Hemant with us. Sir, if you could present.
Is my screen visible? So this is the paper that we published. This was during the quarantine situation that we started these tele-yoga programs. The first session was on 7th April 2020. And this program included a 45-minute yoga practice module. This program is still going on throughout the pandemic. It is open for all and anybody can join. And we could conduct this small study when we did this program. It was a 4-week trial and we had 95 subjects at the baseline and 54 completed the. And what we observed was that there was a significant reduction in their stress levels. People also reported requirement for sleep medications and 16% reduction in requirement for
Could you please expand your screen because we can't see it? Could you give us a presentation view?
Okay, 1 second. I think I have to share my entire screen. Now?
Yes, thank you. Thank you, sir. Please continue.
So this is the first study that we did. There was improvement in stress, requirement for pain and sleep medications. And tele-yoga was found feasible and effective. Then we went on and conducted yoga sessions for the staff of NIMHANS. NIMHANS is a major tertiary mental health care institute in South India. It is a central government institute, and there is a staff of around 3,000 people, and there are more than 6,000 students who study at NIMHANS. So we started these tele yoga programs not only for staff and students but also for our patients. And at various places at NIMHANS they would gather and perform this, and we would conduct this from the NIMHANS Digital Academy. Here we have Professor B.N. Gangadhar, who is watching these sessions here. I'm sure you people would have heard him on the first day keynote address. He is the ex-director of our institute who started the yoga services, the whole yoga journey of NIMHANS. This is another study that we could do on the students who are studying at NIMHANS, especially the residents of psychiatry. These were the people who were under a lot of pressure. They were also taking care of the inpatient facilities. We had special COVID block where we were keeping patients who turned COVID positive and also the staff who turned COVID positive. And we developed a special module. This was not a tele module, but a direct practice module during these times for healthy students, for taking care of their well-being and mental health. And what we observed is that after 1 month of this practice, students reported enhancement of well-being. Their executive function in the memory also became better, and we could do a small sample among these students. 12 students, we could perform their FNIRS to show mirror neuron activation, which suggests that they were able to connect with people better. This is the flyer of the Yoga for Children session that I was talking about. We started these sessions from 17/8/2020, and then we are still continuing these sessions. We could also make 2 separate videos. One is the NIMHANS Yoga for Children 5 to 10 years, and NIMHANS Yoga for Children 10 to 15 years. So if you just put on YouTube these keywords, you will be able to get those videos. If you are interested in joining these sessions, you want your children to join, you can just write to us at yogaforstress.nimhans@gmail.com. Then during the pandemic, when people started turning positive, we developed and validated a yoga program specifically for people who have turned COVID positive. So 3 categories of modules were developed for people who have mild, moderate, or severe symptoms. Experts opined that this particular module, which is a 45-minute module, it involves mainly the last 15 parts are basically relaxation, chantings. So experts opined that it should be advised twice a day. And we started these tele yoga sessions 3 times a day. We did a Google survey and asked people their most feasible time, and these were the time that came up: 7 a.m. to 7:45 a.m. in the morning, 11 a.m. to 11:45 a.m. in the afternoon, and 4 p.m. to 4:45 p.m. So these are the time when people are observing an empty stomach condition, that is 2 hours after their meals, and they can perform certain kind of fast breathing practices. So based on the expert opinion, we came up with these particular kind of practices. The objective of the module was to enhance their cardiorespiratory health and reduce the stress levels and enhance mental well-being. So with these objectives, this module was developed, and you can see that the strokes of the practices reduced, in the moderate category, but the faster breathing practices may create more distress. So experts suggested to avoid in severe category, but still the mind-body coordination was given a lot of importance. Similarly with Bhastrika, Ujjayi is another practice which were advised by the experts, Nadi Shuddhi Pranayama, and then Antar Kumbhaka. Professor Danilo was talking about it. So breathing in fully and then retaining the breath inside would stretch your alveoli, and this stretching may enhance the gas exchange. So that practice was included. And then Bhramari Pranayama, there was a recent paper that suggested that it can enhance nitric oxide levels and bring greater circulation, to vital organs. And then, of course, the chanting part of it. We applied this module on 15 subjects with mild symptoms. And there were 3 males and 12 females. Females were more ready to accept yoga, practice yoga. They had these comorbidities: hypertension, diabetes, asthma. And it was surprising that 86% of these were already using some home remedies, some kashayam. A lot of people actually during these times explored Ayurveda, and their grandma, in India, the grandma's advices were taken up, and yeah, there is a feedback that people found it useful. 12 subjects completed this follow-up. 3 subjects dropped out. 2 we couldn't contact them, and 1 subject said that a relative was in ICU and subject had time constraints. And though we offered the session 3 times a day, we encouraged them to join twice a day, but most of them only could do it once a day. This was the thing that we observed. So average sessions were 14.8 in 15 days. And at the end of 15 sessions, when 15 days, when we asked them how difficult was it for you to practice yoga out of 10, so average rating was 1.2. So it was quite easy for these people to learn this yoga and practice it through the telemode. We also observed some parameters, and there was a definite improvement in their oxygen saturation. There was improvement in their breath holding time, ability. You breathe in and hold inside. So definitely there was a good improvement, and their stress levels also reduced. Subjectively, we asked through a visual analog scale these symptoms, and you can say that 50 to 80% there is a range where reduction in fatigue, myalgia, cough, breathing difficulty, appetite, sleep quality, and perceived stress levels were less. Quickly, I will show you the module that we taught them, and we are still teaching in the morning. So these are the instruction that we give. These are the practices. We first give some preparatory practices, then a set of asanas. We also give precautions, what should be avoided by whom, and then performing breathing in a certain ratio, sectional breathing or vibhagiya pranayama, 30 strokes of Kapalabhati, contraindications, Bhastrika, Ujjayi pranayama, Nadi Shuddhi pranayama, Antar Kumbhaka, Nad Anusandhana. Then feel that we are all connected in harmony, feel the relaxation and a brief kind of guided relaxation, and prayer. So these are the details of these morning sessions which are still going on, and these are the data that so many people have been benefited. So thank you very much. This is not my work. This is the work of the whole team. And I acknowledge Professor B.N. Gangadhar and Dr. Shivrama Varampalli, who are sitting right in the middle, who are our guiding force and our gurus. Thank you very much.
Thank you, Dr. Hemant. Your research is an inspiration for us all, and especially the work at NIMHANS. We all look up to you all. I have time only for one question, and it's something that has been a burning issue amongst psychologists and mental health care professionals. Is yoga going to be introduced as a first line of intervention, like I asked Ananda sir, and be standardized when mental health care professionals work with their clients, work with their patients? Is this going to be a standard protocol for us? Are we going to be taught this in our universities, in our schools, in our colleges? I would like your comments on this, sir.
Wonderful question. Definitely, if you look at the whole ancient Indian tradition of medicine. The definition of doctor, if you look at Sushruta, a good doctor was not defined as a person who has a huge queue of patients waiting for him in the OPD. A good doctor was defined as a doctor in whose premises 10 kilometers around the doctor, there should be no patient. Then there lies a good doctor. So this is the definition that Sushruta gives about the good doctor. So it means that prevention was given a lot of value. Doctor was not only looking at the disease, doctor was looking at the person as a whole. He was looking at the climate. He was looking at ritucharya, dincharya. He was looking at the social structure, the social fabric. Family physician was also a concept which was there till quite recently. It is now only that we see that that concept also has disappeared. So this culture has to come back, number one. Second aspect is, madam, the role of yoga in preventive psychiatry. Preventive psychiatry also is a very important field and need of the hour. Psychologists, we say that psychotherapy, cognitive behavioral therapy, these are the therapies that can have preventive role. But frankly speaking, we will never have such a huge number of trained manpower in country like India. Number one. Second, the cultural acceptability of CBT for Indian rural population. But yoga and Ayurveda, principles of Ayurveda, principles of yoga are right there in the heart of the people. And I also would like to congratulate the government of India for taking the initiative of starting these wellness centers in the villages. 1.5 wellness centers have opened up now in Haryana and UP, and it is taking over all over India. So this vision is there in the leadership of our country also. And it is here that we have to come up. Our focus should be on generating more and more trained manpower which can take hold of these wellness centers, create awareness among people, and definitely there is no doubt about it what Professor Balayogi said, that this prevention aspect of yoga, Ayurveda should be the mainstream of our treatment modality, and all other systems should come as an add-on to it. Namaste. Thank you.
Thank you, Dr. Hemant. I look forward to this new intervention coming into the forefront for us, mental health care professionals and others in the field of wellness and care. So we do not have time for questions, I regret, but if you do have any specific questions, I will do my best to try and give it to the moderators. I'll see how it can be managed later. But this brings us to the close of our session. And I have to conclude by saying that this has opened up a remarkable space. This debate today, this discussion today has opened up a remarkable space. We are standing at the precipice of a new revolution in mental health care and yoga integration. And I want to end by a small poem by my Sadhguru. And there is no other way to say this in a yogi's words, who's achieved that perfected state of samadhi, that no mind, and that he shares with the world. As a leaking vessel never can fill waters of life so pure and still, so distracted mind fails to retain wisdom's nectar in its brain. To fill waters from wisdom's spring, our minds we must to stillness bring. Then our crystal bowl of tranquil mind with gnosis fills of suprenal kind. But if the very thoughts of mind be as fleeting deer and hind, darting waywards ways they find, such men to wisdom's ways are blind. To ease disease of random mind, a remedy suitable we must find. A rhythmic breathing, tension-free, with absorption the sovereign key. Steady poise the arrow your will, and shoot the fleeting mind to still, the deer of thoughts, hinds and hearts, felled by your concentrated darts. As one by one they die away, mind opens up to a new day. Streams run tranquil and willows sway, here tame and gentle deer do play. Tamed and tuned to nature's flow, mind melts into the opal glow, which radiates from the soul within, where wisdom's mystic fire is king. Thank you. This is Yogiraj Sadgurunath Sabha. I thank you all for this beautiful session. I must thank Subodhji, Dr. Prasida, Opi Tiwari ji for giving me this opportunity to be the moderator for this session. And of course, our esteemed panelists, our speakers, thank you so much, Ananda sir, Professor Danilo, Dr. Meena, and Dr. Hemant. Thank you so much. Namaste.
We once again take this opportunity to thank all our panelists, and a special thanks to you, Dr. Meeta, for moderating the session. The tea is outside, but we are ready for the paper presentation on the scientific track. So those of you who are going outside, please be back in 5 minutes. We are just going to set the stage. Thank you.